Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, everyone, and welcome to this episode of the Inspired Hygiene Podcast. So in this season, we are diving into the Inspired Hygiene system and all of its elements. And so this particular episode is the kickoff for where we're going to talk all about mindset. So let's review these elements real quickly before we do that. So remember, the first element that we discussed in the previous episodes was leadership. Then mindset, we're going to talk in the next section about the empowered team, having a calibrated culture, clear clinical protocols, communication, business processes, and metrics. And this Inspired Hygiene system really is what has, over the last 22 years, created consistent, proven, predictable results for our clients that work with us to help elevate their hygiene systems, services, and profitability. And so, we can give teams protocols, we can give them systems, we can give them scripts, but if they don't think differently, then nothing changes. So let's dive into this mindset concept. So yes, with Inspired Hygiene, we bring clinical protocols. We help facilitate the team developing a really clear standard of care. We help them, understand what code to use for which procedure, how to communicate to patients, all those things. But more than anything is we help the team, particularly the hygienists, number one, shift their mindset from one of just running through the schedule and getting the scaling and the polish done and the radiographs done and all my notes done, to really thinking about themselves as a true healthcare practitioner and really shifting not only their mindset, but their workflow to match that as well. The other thing that we truly do that is really where all the results come from is we help them develop critical thinking skills. So we're not just teaching hygienists what to do, we are also teaching them how to think. And that is where the real difference comes. And that is where the results come from. Now, we talk a lot with dentists about, what happens if my hygienists leave? Well, there's always going to be dynamic things and changes in a business, right? And there's never a guarantee that you're going to have hygienists on your team that are going to stay forever. But if you are investing in your team and your practice as a whole to put in place systems that build on critical thinking skills, then new team members that come into your practice are going to understand that is how you operate. They're going to understand that, hey, there's something different about this practice that is we're not just showing up and running this through the schedule, whatever happens to be, whatever procedure happens to be scheduled on the hygiene book. We really are looking at each patient individually every time they come into the hygiene department to really determine what is in their best interest today. So yes, you are training individuals to think, you are creating protocols for your practice, and you are setting a practice culture and expectation from a clinical standpoint of thinking critically and operating as a true healthcare practitioner. Okay. So let's just start with that shifting that mindset. It's in this position on that systems diagram for a reason, right? The first thing, as we talked about in previous episodes, is clinical leadership. The clinical leader must believe that there is a next level that the hygiene team can achieve from a clinical standpoint and also from a business standpoint. And then the next piece is helping shift the hygienist mindset. So why is mindset often the bottleneck within the hygiene departments? Most hygienists were trained to follow routine. I was in dental hygiene school. You do things a certain way. Your instructor comes and checks that off before you can go to the next step. And routines are very important. They help us remember critical steps. If we sat down with a patient and did something in a different order every time, likely things would fall out, right? We'd drop some balls because it's hard to keep all of that in our mind if we're not following a routine. The other thing that we were trained to do is to complete the prophy, right? Complete it, get every speck of stain off, because again, remember, your instructor is going to come and check that. And if there's one piece of calculus, if there's one bit of stain that's left, then all of a sudden that impacts your grade, and your grade being impacted can impact your whole trajectory of your dental hygiene education. Okay. So we were trained to do that. And sometimes that can honestly get in the way of really looking at the big picture of the patient. We get so focused on those couple elements of like following this exact same routine, making sure we get every speck of stain off. And, to the point that every time we see a patient in private practice, it's like we're being expected to, have an instructor come and check us. That's not the role of the dentist. And there are times, believe it or not, where, there are more critical things that are important to address than stain. One of my mentors, Chris Bowman, told me one time, he's like, Rachel, I've had patients come in with a periodontal abscess. I've had patients come in, with a tooth that's broken, but I have never once had a patient come in with a stain emergency. And the point that he was trying to make to me is, hey, I'd rather you spend the time on the front end in this hygiene exam before you start scaling to really make sure that we are addressing things that could really, truly be a problem, rather than trying to rush to the scaling because I know I've got to get every bit of this, sweet tea stain off of this patient's teeth. So that is an element of mindset shift, is really looking at what are truly the most important pieces of this hygiene process. So the real issue is not a lack of knowledge. It's not a lack of effort with hygienists. It is often a lack of critical thinking in real time, right? If we're just running through the schedule, then we're often not practicing at the level that we can, and at the level that is necessary in today's like modern age of dentistry. We know so much now about the oral systemic link. We know so much now about screenings that we can offer to patients that are going to make a critical impact in their life, truly, that, it's really important to make sure that our mindset is solely and fully set that I am a true healthcare practitioner, and that is my most important role. So in order to shift those mindsets, sometimes we need to first shift the mindset of getting out of our comfort zone. And what that looks like with Inspired Hygiene is really kind of setting the tone with the team of, are you in a fixed mindset or are you in a growth mindset? And really looking at that through a clinical lens. So a fixed mindset in a hygienist might be, this is what's scheduled, so this is what I'm going to do today. Or I don't want to, open something or dress something that I can't fix. And I'll tell you a huge mindset piece that very often teams and hygienists don't realize that is running in their subconscious is this one. And it is, I don't want to diagnose this patient with periodontal disease and go through the whole treatment recommendation process if I can't get them in the schedule within a timely manner. And hey, I get it. Like that, there's an element of that makes a lot of sense, right? There are practices still that are booked out 4, 5, and 6 months. So what's going to happen if I educate the patient on this diagnosis? They have active periodontitis. I'm recommending non-surgical therapy, and I'm creating this sense of urgency with them. And then we go to schedule, and it's like, yeah, I can get you in 3 months. So that is a huge mindset block, I will say, that is very common right now. And so if you're seeing in your practice that you are booked out many, many months and you don't have time to get those patients in for scaling and root planning, or you really haven't even had that realization yet, but you're looking at your hygiene schedule and you say, hey, I look back next month and we had 1 open appointment and we have nothing blocked going forward for new patients or scaling and root planning, then it's likely that this mindset has taken hold in your hygiene department. So this is a big one. And it not only takes shifting the mindset, it takes some actual practical scheduling adjustments too, right? Because how am I going to shift my mindset when I still can't get this patient in for 3 months. Like, we haven't solved for that. And certainly there are some practical ways, and we can get into that in other episodes, that we can really address that. But that's something to recognize, right? Is our schedule creating a mindset block for our hygienists in diagnosing? The other fixed mindset that we sometimes see in hygiene is, I'm just going to let the doctor handle that. So the hygienist either isn't confident in bringing up needed treatment, whether that is restorative treatment or whether that's periodontal treatment. And what that creates then is it creates a situation where the doctors have to step out of a very intense procedure, and sometimes a surgical type procedure, and then come in, and then they've got to start the conversation with scratch. They've first got to identify where the problems are, and then they've got to decide which one is most urgent, and then they've got to think about, how am I going to present this to this patient in a very short period of time, which, by the way, a lot of times the hygienists are really trying to get the doctor in and out. So hygienists, I always say, is the growth mindset of that is, how can I pre-identify areas that the doctor's likely going to discuss with the patient, so that I can take a photo, I can bring it up, I can start that conversation, because that way when doctor comes in, if that patient is already primed, then we can let the doctor know, hey, you see this photo here, this is actually number 2. I noticed that this filling, it looks like it's about ready to break. It looks very weak. And they said they're having some sensitivity to chewing in that area. So can you really take a close look at that? All of a sudden, you have eliminated the vast majority of effort that the dentist has to make to get that treatment recommended, treatment planned, and in the books. And I will tell you, it also is going to make those doctor exams more efficient and faster. And so when we spend as hygienists a little time on the front end, it's actually going to save us time on the back end. And that's another mindset shift. Okay. A growth mindset would be, what is the patient actually presenting with today? So yeah, they're scheduled for a bite wing and prophies, but I'm going to do my hygiene exam in that first 15, 20 minutes. And really my mindset is, what is really in their best interest today? Is the prophy appropriate? Or do we need to address something else, right? Do they need gingivitis therapy? Do they need non-surgical therapy for periodontal disease? What about another growth mindset question might be, what am I seeing that doesn't match the schedule? You know, does it look like they're actually due for a full mouth series, or it would be in their best interest, I should say, for them to have a full mouth series, but it's not on the schedule? You know, what am I seeing that doesn't match up with what was pre-planned for them? That is a form of critical thinking. I would say another question is, how do what am I seeing in their medical history that could be impacted by their oral health or is impacting their oral health, right? And how do I connect those dots? Another growth-minded question might be, what did the patient just say to me that is going to be a point of value that I can bring up to them with the treatment I'm about to recommend? So let's say the patient just told me, you know what? I just started on a GLP-1 because I really am focused on getting myself healthier. I know I've been trying to lose some weight for the last 5 years and it just hasn't been coming off. So I decided to start this. I'm a little nervous about it, but I'm also excited. And I really, it's just gotten me kind of launched into like eating better. I'm exercising more. Okay. So they've just told you that they are health focused. And so now if I do the periodontal assessment and I see they've got bleeding, either they have moderate to severe gingivitis, they have localized periodontal disease, then I'm bringing that up 100% and I'm tying it back to their goal of getting healthier. It's like, look, I know you're working on this and you have active infection in your mouth and in the gut and the bones that support your teeth. So I want to give you real clear information on that. We're going to make a recommendation to stop the progression of that disease. All right. So that is where I'm listening and I'm tying those things into what is going to be in their best interest. I'm not saying that you're not going to be able to lose weight if you don't treat your gum disease, but I'm tying into their goals to be healthy. And their goals to be healthy are ultimately reducing high blood pressure, risk of heart attack, risk of type 2 diabetes. And guess what? Treating periodontal disease is all in line with that. So that's a really good example of shifting from that just running through the schedule mindset to really being part of their healthcare team. Okay. So the schedule is a guide. It's not a diagnosis, right? We can use that as a guide, but really we want to look at what is in our patient's best interest. Okay, so let's talk about this concept of critical thinking. We talked about that a bit when I mentioned the patient that's concerned with their health, right? Critical thinking in hygiene really means looking at the whole patient, looking at their medical history, their risk factors, what are their patterns, and really interpreting that data. So we're not just checking the box that we collected the data, we're interpreting it. What does this mean? And then how do we make that connection to the diagnosis and treatment and really making it personal to the patient? So an effective recommendation, whether that is for a clinical procedure or whether it is for a sauna care, is like, how do I make this specific and personal to this patient? It is never, well, our policy is to do an FMX, every 2 years. No, it is in your best interest. You have had a lot of dental work. You have a lot of crowns that you've invested in. You have implants that you've invested in. And so it is in your best interest to do these x-rays so that we can see the root, we can see the stability of all these implants and really make sure everything looks like it's healthy and stable. Okay. So we're making that personal, and we're using our critical thinking skills to develop that type of communication. Okay. The other piece with critical thinking is let's say we see bleeding in an area. Sometimes hygienists will say, well, what do we do if the patient's healthy everywhere, but they have got this one area where they have bone loss and they have bleeding and, they have a 5 millimeter pocket depth. And I say, what is the reason? Why is the patient bleeding in that area? What's happening there? Do you have a plunger cusp that is jamming food between that contact? Do you have an open contact? Do you have an overhang? Right? So really thinking beyond just, I've got to get in there really good today because it's bleeding and we'll just check it the next time. Like, how do we come to an end solution for this? Okay. So having the data that we collect in our hygiene exam, just having that data alone, that's not going to change the patient's clinical outcome. We really have to interpret that data and make a recommendation for a better clinical outcome from there. I've talked about this a little bit already, but this identity shift of thinking like a healthcare practitioner, and this is really where the mindset and the critical thinking skills merge, is instead of, I clean teeth or I follow the schedule, it really is, I am a preventive specialist. I am a periodontal expert. I am a diagnostic partner with my dentist. And where that really helps us shift our internal identity is not just like, hey, I showed up and I saw 8 patients. It is, I help these patients find solutions today. They're going to be healthier because of their time with me. Even to the point, and we see this all the time with our clients, is even to the point of literally saving lives, identifying an area that looks suspicious, getting that patient to an oral surgeon for a biopsy, could result in early detection of oral cancer. I have seen it happen in my family. I have seen it happen with our clients, and their patients, and also with their team members. So really remember that you're not only the dental healthcare provider for your patients, you're also that dental healthcare provider for your team. So really be sure that you're looking at them through really critical eyes from a health perspective too, and how you can help them have better clinical outcomes. So healthcare practitioners don't just follow those routines. They really take the information, they analyze and think critically about what they're seeing, and they help their patients make the best decisions for them. Okay. Now, all of this is really supported by a clear belief system. So when we go in and coach a team, our first goal is to get those hygienists in particular to shift their mindset from cleaning teeth to being a healthcare practitioner. And the second piece is believing that they have the impact to make, they have the power to make a huge impact on their patients' overall health. And then we also help the rest of the team support that, right? We get the rest of the team to believe in their hygiene department at that level. And they've got us do all the supportive pieces that allow the hygienist to present and complete the treatment that's going to help those patients get healthier. So these belief systems that can block that critical thinking, that can block them stepping into that next role, are things like our patients won't accept this treatment, or how am I going to tell this patient I can't tell this patient I've been seeing for 8 years that now they have periodontal disease. And you can tell them, and it is our duty to tell them. And sometimes the hygiene team just isn't sure how to bring it up. And so we'll talk about that in the communication element of the Inspired Hygiene System in this season of the podcast. We'll talk about that because that is a huge barrier often, is that fear that the patients are going to wonder, like, well, why didn't you tell me this before? And it is extremely rare that that comes up actually in conversation. But we're going to tell you how to handle that, even if it does. Okay, so keep an eye on our podcast. That'll come later in the season. But there's other belief systems like, well, I'm not the one who diagnoses. But as hygienists, we are critically and fully capable of observing and noting and educating patients. So dentists, sometimes this will shut a hygienist down. Well, I'm not supposed to diagnose. That doesn't mean that the hygienists are not capable of observing, noting, and pre-educating the patient of what's going on. So, hygienists, really think about the belief systems that you hold and, how you can overcome those. Sometimes it is, I don't want to overwhelm the patient with this. They've got all these other things going on. But this is where you go back to that critical thinking and how can your diagnosis and treatment actually support, right, them having a better outcome with this other health issue that they're going through. So, sometimes we hear teams say, well, we didn't want to present treatment because they're getting ready to go through chemotherapy. Well, they should not be going through chemotherapy with an active infection in their mouth, right? That could impact their overall, experience with this treatment. So really, it's important for us to be clear and honest with our patients and what is happening in their mouth and how that impacts their overall health. Remember too that clarity builds trust. It doesn't create pressure. And it really is, I think the other mindset shift is that our patients deserve to know their health status. And that is why they're coming to you, right? Yes, they're coming to have the stain removed, but they're also coming because you all are a team of dental experts. And so whether you are on the business team and you're a dentist, you're a dental assistant, or you're a hygienist listening to this, you have a critical role in helping your patients say yes to the treatment that is in their best interest. And withholding a diagnosis, whether it's intentionally or unintentionally, is not in the patient's best interest. And it's also not in your best interest because it creates risk, right? I was just talking to a dentist this week, actually, that has extremely low periodontal diagnosis and treatment in their practice. And her fear is that if she brings in new systems, that she may risk her hygienist not wanting to follow those systems and leaving the practice. And it's, it's not easy finding hygienists right now. However, my message was really clear to her is you're in a position of risk, and so is your hygienist. So when there's undiagnosed periodontal disease that can be shown very clearly on radiographs, in clinical notes that there was bleeding, on perio charting, and all of that, and there's not a diagnosis and treatment recommendation made, not only is that not providing the patients with their accurate health information, that's creating health risk for them. It's creating liability risk for the dental team. So that's a really important piece of that. And yes, there are times when hygienists move on for various reasons, but as a practice and as a clinical leader, you are responsible for setting the tone of those standards of care and working with your team to develop those and keeping those in place as a dentist and practice owner. So how does this mindset shift change our day-to-day experience? When hygienists think differently, their appointments with patients become more engaging, right? The conversations are more meaningful. They're more about their health, right? So hygienists are really good about building relationships and having conversations that feel personal. But a lot of times those personal conversations are about vacations, or they're about renovations, or they're about, things like that. Maybe somebody's getting married. And while those things are important, that's not why your patient came to you, right? They came to you because you're part of their healthcare team. And so we can very quickly touch on those things and create really meaningful conversations about this patient's overall health. When we shift our mindset into that role as healthcare practitioner, the diagnoses become more confident, they become clearer. And the patients, not only does the team members' confidence and the doctor's confidence increase, but the patient's confidence in the treatment you're recommending increases because you're showing them the evidence for what it is that you're recommending, right? You're not just saying, hey, when we see bleeding, we do scaling and root planing. The patients don't really get that. It is no, like you have active inflammation, and so we're recommending periodontal therapy to stop the progression of that inflammation. And guess what? This type of communication and this type of mindset shift actually reduces burnout. Sometimes when we think differently and we're using our critical thinking skills, because it's something different than the way we've always done things, it can feel like more work at first. But when we start to settle into this and we start to see the patients respond to it, and we start to recognize that I don't need to feel like I have to treat periodontal disease and a prophy every day, all day long, then it actually reduces burnout because we're engaging our minds in a different way. We are actually treatment planning and having the time to treat disease appropriately. It also, when we're able to do that, then we see better patient outcomes. Instead of seeing the same patients with the same inflammation and bleeding over and over and over, we're actually seeing a better result. And that's very rewarding. So it ultimately can actually reduce burnout because you're just no longer stuck in that monotony and you're practicing at a much higher level. So critical thinking really turns hygiene from repetitive to very purposeful. So what does this mean? It means that mindset shift is a critical piece to making any protocol or systems change in your practice. So if you have been talking with your team leaders about, hey, it's time we really need to revisit and evaluate our periodontal diagnosis and treatment protocol, right? It's more than just writing down, we're going to do a prophy here, and then when we see this, we're going to move this patient into non-surgical therapy. It's more than that. It's really, why? What is the purpose of making this change? What is that purpose? And I would say dig really deep, right, into the purpose of really providing the highest level of healthcare, not just oral care, but overall healthcare that you possibly can, and that is within your scope of practice. One of the things that we're going to talk about in a future episode when we talk about clinical protocols in that element of our system is life-saving screenings. And what are a few of those life-saving screenings that hygienists really are on the front line on? And how can implementing those life-saving screenings really help shift us from cleaning teeth really into that role as a healthcare practitioner? So you're going to hear some other thoughts and insight on how to shift your own mindset, how to help your team shift their mindset so that they're willing to step into this role and willing to step out of their comfort zone. So can't wait to dive into this deeper on the following episodes. And thank you so much for being with us. And a quick request is if you're enjoying this podcast, I would love it if you would just go to your podcast platform and leave us a review and share this with a friend. We'd love to get this message out. So thank you so much. See you on the next episode. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.